SDPB serves South Dakota through an interconnected communication system that is on 24/7, 365. The first place for Amber Alerts, public safety announcements, and EAS messages. SDPB keeps public servants and citizens informed. Good, useful, and full of wonder. SDPB. SDPB brings you closer to your government. With gavel-to-gavel coverage of the South Dakota Legislature and in-depth reporting from Pierre. Good, useful, and full of wonder. SDPB. From early learners to lifelong students, SDPB inspires curiosity through trusted educational programs and resources for every stage of life. Good, useful, and full of wonder. SDPB. When South Dakotans need reliable information, SDPB is there providing updates and coverage that keep our communities safe and connected. Good, useful, and full of wonder. SDPB. SDPB celebrates South Dakota's student athletes with live coverage of SDHSAA state championships, sharing the excitement of hometown heroes. SDPB, good, useful, and full of wonder. From choir to debate to theater, SDPB shines a spotlight on South Dakota's talented students through SDHSAA All-State Fine Arts programming. Good, useful, and full of wonder. SDPB. Every day, SDPB connects South Dakotans with stories that inform, inspire, and bring us together. SDPB, good, useful, and full of wonder. SDPB is your home for fact-based journalism, connecting South Dakotans with news they can trust and stories that matter. Good, useful, and full of wonder. SDPB. From children's programs to in-depth documentaries, SDPB sparks curiosity and lifelong learning in every South Dakotan. SDPB. Good, useful, and full of wonder. SDPB brings South Dakotans together, telling the stories that unite small towns, big ideas, and the people who make our state shine. Good, useful, and full of wonder. SDPB. SDPB shares the voices and experiences of South Dakotans, preserving our stories, our culture, and our sense of place. SDPB, good, useful, and full of wonder. As South Dakota's public media network, SDPB serves everyone with transparency, integrity, and commitment to open access. Good, useful, and full of wonder. SDPB. SDPB helps shape South Dakota's future by educating, informing, and inspiring the next generation of thinkers, leaders, and creators. SDPB. Good, useful, and full of wonder. SDPB serves South Dakota through an interconnected communication system that is on 24/7, 365. The first place for Amber Alerts, public safety announcements, and EAS messages. SDPB keeps public servants and citizens informed. Good, useful, and full of wonder. SDPB. SDPB brings you closer to your government. With gavel-to-gavel coverage of the South Dakota Legislature and in-depth reporting from Pierre. Good, useful, and full of wonder. SDPB. From early learners to lifelong students, SDPB inspires curiosity through trusted educational programs and resources for every stage of life. Good, useful, and full of wonder. SDPB. When South Dakotans need reliable information, SDPB is there providing updates and coverage that keep our communities safe and connected. Good, useful, and full of wonder. SDPB. SDPB celebrates South Dakota's student athletes with live coverage of SDHSAA state championships, sharing the excitement of hometown heroes. SDPB. Good, useful, and full of wonder. From choir to debate to theater, SDPB shines a spotlight on South Dakota's talented students through SDHSAA All-State Fine Arts programming. Good, useful, and full of wonder. SDPB.
Okay, we'll get started with House Military and Veterans Affairs Committee. Just a few housekeeping items. If you could shut your phones off so we don't hear them buzzing and screaming at us. And have all the exchange will come through the chair. If you have anything, everything goes through the chair so we can be organized and be respectful to everybody. Makes things go a lot faster. The first bill on there, we're going to take them in order, is House Bill 55, excuse me. And so I'm going to turn I'm going to present that bill, so I'm going to turn the gavel over to Mr. Vice Chair. Yeah, I'm going to do that. So I'm going to turn it over to him. Before we do that, we got to approve the minutes from last meeting. Do I have a motion? Has anybody read the minutes? Moved by Representative Randall, was it? Oh, sorry, Representative Shorma. Seconded by Representative Randall. All those in favor signify by saying aye. Aye. Opposed, same sign. Minutes are approved. What else we got next? Can I turn it over? I don't have any. Oh, we do. Sorry, I wasn't trying to keep you out there. Okay, at this time we'll introduce the pages, or page, I guess, singular. Can you come up and introduce, say where you go to school, and what branch of the military you're going to join?
I go to school at Rapid City Christian. I guess if I had to join one of the branches, probably Air Force. Yeah.
I guess being in the Air Force in Rapid City is kind of hand in glove, right? That's where you'd want to do. You should go to the Air Force Academy and come back and fly a B-21 bomber. Yeah, B-1s do, not B-21s. Yeah. Okay, what's up? Yeah. Okay, next we're going to call roll. Mr. Secretary, you call the roll.
Representative Andera is excused. Elward.
Here.
Baxter. Here. Jorgensen. Here. Kaiser.
Here.
Moore.
Here.
Poyer excused. Randolph.
Here.
Shorma.
Here.
Schubeck.
Here.
Weems. Excused. Reich.
Here.
Goodwin.
Here.
Mr. Chair, you have a quorum.
Okay, thank you. We have some people, just for the people listening out there and on the airways, we have some people going to state affairs for a couple of bills over there, and I'll be doing that as well. So we'll be going in and out, but we do have enough to actually have the meeting. We have a quorum, so we're good to go. So without further ado, I will turn the gavel over to Mr. Vice Chair, Major General Tim Reich.
Okay, first up we have House Bill 1255. House Bill 1255, an act to require that the Department of Health accept the medical records of a veteran applying for a medical cannabis registry identification card. So we're open for opponents, House Bill 1255. Representative Goodwin. I'm sorry, proponents. You're a proponent? Proponents.
Let me get organized here, but thank you, Mr. Chair. I'm Representative Tim Goodwin. I come from District 30, and I'm here to be the proponent for this bill. If I can get things set up, just give me a second. Okay, this is House Bill 1255. It's an act to require that the Department of Health accept the medical records of veteran applying for a medical cannabis registry and identification card. And everybody kind of looks like, because they know I'm kind of hardcore. I told the police officer the other day when I had my accident that you can look for drugs in my vehicle if you want, but I've never even had a joint, so I don't even know anything about drugs. None of them have any. So everybody's wondering, what are you doing carrying this bill? Well, there's a difference between medical marijuana and recreational marijuana. And if we have it authorized, I just want to have it where if it's going to help veterans, with their health concerns, they should be able to use it if it's prescribed. And the biggest concern I think everybody in this room has right now is our suicide rate among veterans. And so if we can do something that would ease their pain or make it so that they don't feel so desolate that they go to the drastic steps of committing suicide. So that's kind of my brain process. So if you think I'm crazy, maybe I am, but that's why I'm signed on with this bill. Basically, if you look up the bill, you can read through it, but it requires a few things. It requires a written certification issued by the practitioner within 90 days, immediately preceding the date of an application. There is an application fee or a renewal fee, or there can be. The name, address, and date of birth, qualifying for the patient, except that if the application is homeless and no address is required. The name and address and telephone number of the qualifying patient's practitioner, name and address and date of birth of the designated caregiver or designated caregiver chosen by the qualifying patient. If more than one designated caregiver is designed at any given time, the documentation demonstrating that more than one caregiver is needed to qualify the patient's age or medical condition. And it goes on if you go on with all the other, guardrails in there so that we can do this in an ethical way, but we can still take care of the veteran. I guess I'll turn this over to the other proponent testimony, and I'll stand by for questions.
Thank you, Representative Goodwin. Are there other proponents?
Good afternoon, Mr. Chairman. Mitch Richter with Genesis Farms. I'm having the page pass around a sheet that I pulled off of the VA website. So that's the origin of the information that you're going to see there. It talks about what the VA does and doesn't do. But this legislation does one simple but very important thing. It removes an unnecessary barrier for honorably discharged veterans who are already eligible under South Dakota voter-approved medical cannabis law. Let me be very clear at the outset. This bill does not create a shortcut. It does not weaken the standards, and it does not allow someone to bypass medical qualification. South Dakota law requires certification of a qualifying condition. Certification is not a recommendation. It is not a prescription. It is simply verification that a patient has a condition listed in the statute. Other South Dakotans can obtain their certification from a private provider. Veterans who receive care through the VA cannot, not because they lack a diagnosis, but because federal law prohibits VA clinicians from recommending marijuana or completing the paperwork required for participation in state programs. The VA itself makes very clear, VA clinicians may not recommend medical marijuana, VA clinicians may not complete state-required forms, and the VA will not pay for it. So what happens? A veteran with documented PTSD, cancer, chronic pain, or any other qualifying condition must leave the VA system, pay out of pocket for a separate appointment, and seek out a private provider solely for paperwork. That's the barrier. This bill simply allows the Department of Health to verify the veteran's existing VA medical records documenting a qualifying condition along with proof of honorable discharge instead of requiring a separate certification form. All other safeguards remain intact. The veteran still pays the fee, registers with the department, is subject to annual renewal, purchases only from licensed dispensaries, and complies with product limits and safety standards established under the South Dakota Code. Nothing about this bill expands qualifying conditions, and nothing loosens oversight. I understand the department may express concern about taking on liability or playing doctor. Respectfully, that is not a diagnosis, it's a verification. They are the administrative arm of this program. State agencies routinely review medical documentation for eligibility determinations. Medicaid has prior authorizations, disability determinations, and medical necessity reviews all require agency staff to verify clinical documentation. This bill asks the Department of Health to verify that VA records document a statutory qualifying condition, no more, no less. And I would emphasize South Dakota voters approved this medical cannabis program. The structure and safeguards are already in place. This bill preserves the framework while ensuring veterans are not uniquely disadvantaged because the providers that they attend work within a federal system. We ask much of our veterans. They served under conditions other than dishonorable. They carry documented medical diagnoses. They deserve equal access to the legal system South Dakota voters created. This bill maintains standards, maintains safety, and corrects an inequity. I respectfully ask for your support of House Bill 1255.
Thank you, sir. Are there other proponents? Welcome.
Good afternoon, Mr. Chair, members of the committee. My name is Tara Larson. I'm an attorney here in Pierre and registered lobbyist for the Cannabis Industry Association of South Dakota. Well, I see that Representative Shorma and Representative Moore are wearing green today, so I'm hoping that's a good sign, right? Mint. But we love green. I don't need to belabor the point. Mr. Richter from Genesis Farms did an excellent job of presenting this. A lot of our veterans are very, very low income, and they definitely do have those qualifying conditions, and it's very difficult for them to potentially pay for that provider that can actually certify that qualifying condition. And so we stand in support of this bill. We hope that you also stand in support of this bill, and I will stand by for questions. Thank you.
Thank you, Ms. Larson. Other proponents? Any other proponents? Do we have anybody online? Okay, seeing none in the room, we'll go online. Who do we have online? Casey Entwistle?
Yeah, Casey Entwistle.
Is Casey Entwistle online?
Yes, I am.
Okay, go ahead, introduce yourself, and proceed with your proponent testimony.
Thank you. Good afternoon, Chair and members of the committee. My name is Casey Entwistle, and I'm here today representing myself as a McCook County resident and as the patient representative on the Medical Marijuana Oversight Committee. I'm also here because of my father and to honor a veteran's request. My dad is sitting here with me today. Randy Knudsen is a Vietnam veteran who served 2 tours as a recon Marine in 1968 and 69, where he was exposed to Agent Orange. After decades of complex medical challenges, medical cannabis has been the single most effective tool in improving his quality of life and his health. Our family has seen firsthand what this program, overseen by the Department of Health, can do when it is safe, when it is regulated, and it is properly administered. Since my appointment with the Oversight Committee, I have spent significant amount of time engaging with patients and reviewing more than 20 hours of committee meetings and records. What became clear to us is that veterans face unique barriers to accessing this otherwise well-run program under the Department of Health. Today, many veterans in South Dakota are turning to illegal products unregulated products sold in smoke shops across the state of South Dakota. These products are untested, unlabeled, unsafe, and illegal. All of the negative safety concerns raised before the Oversight Committee last fall were traced back to these illegal products. Veterans deserve better than being pushed towards unsafe, illegal alternatives. The Department of Health's medical cannabis program is safe because it's regulated, it's tested, and it is accountable. It is the only legal pathway that ensures product safety and patient protection for our South Dakota veterans. This program is the program veterans should have access to. And unfortunately, because the VA is federally funded, many veterans cannot obtain a physician's certification that is required under state law, even when they clearly qualify. As a result, they are locked out of the regulated system and pushed towards illegal, unsafe products. House Bill 1255 is a narrow but reasonable solution. It allows the Department of Health to issue a registry identification card to a veteran who submits the qualifying documents in accordance with the rules already administered by the Department of Health. I want to be very clear that this bill, this bill does not do. The House Bill 1255 does not ask the Department of Health to diagnose, prescribe, or provide medical treatment. It does not place the department in a role of the physician. The department is not making any medical decisions. It is only verifying eligibility based on existing documents and issuing a registry card, which is an administrative function that is already performed for all civilian patients. This bill does not eliminate standards of care. Veterans are not asking for lower standards. They are asking for the best products. They're asking for alternative administrative pathway because the federal law prevents their providers from participating in this program. Their medical history and service connections already exist. They are already documented. The Department of Health is the highest standard of care the veterans deserve.
Okay.
Nothing in this bill changes the department's role regarding patient use, diagnosis, treatment, or decisions. Patients remain responsible for their own medical choices just as they are today. The department's role remains administrative, not clinical. By denying veterans access to the regulated program, we are unintentionally steering them to illegal, unregulated, and unsafe products.
Okay, thank you.
House Bill 1255.
Ma'am, we're kind of getting a little repetitive now, and we've got 6 bills here this afternoon. I hate to cut you off, and we've got 5 more people that want to testify in this bill, and so please wrap it up because we need to keep.
Yep, I got 2 seconds left.
Go.
If that's okay. Yep, the House Bill 1255 corrects the problem while preserving the integrity of the medical cannabis program. This bill is about regulation, safety, and fairness. Veterans fought for our country, and they should not be excluded from safe, legal medical cannabis because of a federal conflict they didn't create. For this reason, I respectfully ask you to support House Bill 1255. Thank you for your time today. I'll stand by for questions.
Thank you. Next, we have remote testimony. Marty Pennock. Are you on, Marty?
I am, sir.
See him. Okay. Go ahead with your proponent testimony.
Good afternoon, Mr. Vice Chair and members of this committee. I'd also like to just say thank you to Chairman Goodwin for getting this bill to the table for us. Certainly wish him our best. We understand he's been through some trauma lately. Thank you, sir. My name is Marty Pennock. I'm a retired Army colonel with 4 deployments to Iraq, and I'm here as the Vice President of the South Dakota Veterans Council and representing those members within that council. I'm also here as the adjutant of the DAV Department of South Dakota, representing nearly 5,000 members in South Dakota. I'm honored to testify before you today in strong support of House Bill 1255. House Bill 1255 is about something very simple. As already stated, it's fair access to care for the men and women who have served our country. All this bill asks is something reasonable and compassionate. Department of Health accept the VA medical records that have already been documented, diagnosed, and treated our conditions. These are not casual notes. They are verified federal medical records created by licensed professionals in the largest integrated healthcare system in the nation. Records that required us as veterans to relive our trauma in order to receive care in the first place. House Bill 1255 does not expand eligibility as already stated. It does not weaken the safeguards. It simply removes an unnecessary and harmful barrier for veterans who have already proven their medical need. For many veterans, especially those in rural communities, this means fewer appointments, reduced financial burden, and faster access to a treatment option that is already legal in our state. But more than that, it sends a message that South Dakota trusts its veterans, respects their service, and will not force them to reopen invisible wounds just to receive lawful care. We often say we support our veterans in South Dakota, and House Bill 1255 gives us that opportunity to prove it. On behalf of the South Dakota Veterans Council, I respectfully and strongly urge your support and a due pass recommendation on House Bill 1255. Thank you for your time and for your continued commitment to South Dakota veterans.
Thank you, Mr. Pennock. Next, we have Gene Murphy up. Is he with you there, Marty?
He is. I'll move out of the way so he can get in my place.
Okay, thank you.
Thank you, Mr. Chairman. Again, I'm Gene Murphy, a lobbyist for the Disabled American Veterans. I'm a Vietnam combat wounded vet with a spinal cord injury from 3 gunshot wounds. And again, we would ask your support on House Bill 1255. I sent you different articles on February 9th, and the articles were DAB Resolution number 326, supporting comprehensive VA research into medical cannabis. Again, VA and marijuana, what veterans need to know. Again, Trump orders would allow more VA research on medical marijuana. That was the executive order. And then also VA doctors and medical marijuana 2025 Veterans Equitable Assessment Act, and you should have received all them. Again, under this new legislation, again, VA physicians can authorize to recommend medical marijuana, and also they can complete the state required paperwork as long as states have legalized medical marijuana. Again, importantly, veterans in legal states who choose to use medical marijuana will continue to retain their VA health care and disability benefits. Again, this helps manage chronic pain, PTSD, and other service-related conditions. Again, veterans can now turn to VA doctors for guidance and official recommendations. Again, this would eliminate the need to pay out of pocket for private physicians or to navigate the system alone, a challenge that has long frustrated those seeking alternative pain management. And again, we see that if this bill was passed, it would benefit veterans where it would reduce financial burdens. It would simplify the process using records of veterans already possessed with the trusted VA providers, and improved access to care, especially for rural and low-income veterans, acknowledge veterans' unique healthcare system, and remove unnecessary barriers and respect confidentiality. Again, rely on established federal medical documentation. Again, we would hope that you would support this. And again, we thank you for your support and assistance to our heroes. That's our veterans. Thank you, Mr. Chairman.
Thank you, Mr. Murphy, for your testimony. Next up, we have Barb Knudsen. Is she there? Is she online, Barb? I don't see her. Okay, we're going to go to the next one then. Randy Knudsen, would you like to testify?
I'm here. Hello?
I think that Casey there already testified. Do you want to give testimony as well?
Just real short, a lot of it's the same, but I'm a Vietnam vet. Been 2 tours over there, 100% disabled. I've, over the last 40-some years, seen a lot of doctors, heart doctors, kidney doctors, you name it, diabetes, I got it all. And over the last number of years, I've taken all these drugs. And in the last 3 years, I got on medical cannabis. All my numbers have improved. It means a lot to have this all these years and now see improvement that comes from this and have people try to bar that from you. We really appreciate you looking at this. Thank you.
Thank you, Mr. Knudsen, for your testimony. I think that's all we had on the list for proponents. And so we'll now go to opponent testimony in the room. Opponents of House Bill 1255. Madam Secretary, welcome.
Melissa Megstead, Secretary of Health. You know, it's hard to be against the people the patients that I love, that we take care of in the medical cannabis program. You know, Mr. Knudsen, I will tell you, I don't know if you could have favorite patients, but he is one of mine. So, Mr. Chair, members of this committee, it is absolutely true that VA patients cannot be certified through their provider. Absolutely not. That is absolutely true with all federally funded institutions. Indian Health Services, nope. Federally qualified health centers, who are those people? Anybody who goes to the Horizon Healthcare Clinic, Falls Clinic in Sioux Falls, Complete Health in Rapid City. Those are also federally paid healthcare entities, and so they cannot also certify patients for medical cannabis, not because of our rules, but those are federal rules. But that also is true for the 3 health systems in the state. They have made policies that they don't allow their providers to certify for medical cannabis. So it is very typical for most patients in the state of South Dakota to not be able to use their regular provider to certify them for medical cannabis. That is absolutely true. And I wanted to say that up here at opposing this, my respect for the veterans is very personal. My dad served 42 years in the National Guard with some of the folks that are in this room. Served with my dad. My brother was a Navy SEAL. My other brother was in the National Guard, and my grandpa served in the Pacific Rim in World War II. So this bill has nothing to do with veterans. It has everything to do with patient care for me. And I want you to understand that we're coming from that. I have an enormous amount of respect and compassion for the veterans of our state, especially those that suffer with PTSD. That's a very specific place in my heart. For my grandfather suffered with that as well. So because of that, I want to be very clear. The Department of Health's concerns with this bill have nothing to do with a lack of respect for a veteran and nothing to do with opposing better access to care. I would tell you that as your Secretary of Health, I have been the most progressive in access to care in about every policy that we have aimed for in the few years that I've been here. So I 100% support reducing access to care barriers, especially if they're safe. And this is about patient safety. This bill raises some serious concerns for me in 2 areas. One of them is patient safety and liability. Let me explain to you how the medical cannabis program works right now. And I should also let you know, because I don't think many of you know this, that I have a real job. And my real job is that I'm a nurse practitioner. I've been treating patients in the state of South Dakota for over 30-some years. I've been here long enough that I had brown hair at one point. Representative Jorgensen and I have compared notes. And now I'm fully in white hair. That means I've taken care of innumerable patients in the state of South Dakota. I know how to take care of patients, and I know how to do it safely. So under current law, a patient with the qualifying condition is evaluated by a healthcare provider who has specific knowledge and education related to medical cannabis. Not everyone who practices in the state of South Dakota with the medical license has knowledge and special education regarding medical cannabis use. They're not trained in that in school. This is special knowledge that people have. And that provider then conducts an in-person evaluation with the patient and establishes what we call a bona fide patient relationship. That means we actually, healthcare provider that I'm being right now, we looked at the patient's medical history. Did you have a heart attack? Have you had cancer? Have you lost a kidney? Have you lost a lung? Or do you have congestive heart failure? All of those things I'm going to look at. I'm going to look at your view of medications. There are certain medications that medical cannabis is not appropriate for, or would be such an adverse effect if mixed with that medication that to add medical cannabis is going to kill that patient. Should not be used in that particular patient, or the medication should be changed before medical cannabis is added. These are all important things. We perform a physical exam. At a very least, someone should have their heart listened to, they should have their lungs listened to, they should have a blood pressure checked before anybody prescribes any type of medical intervention whatsoever, whether that's a medication, whether that's physical therapy, whether that's any type of intervention for whatever that we're adding. People deserve to have the bare minimum healthcare standards applied to adding a medical treatment. And as a healthcare provider, we ask some critical conditions. These are the things that are going inside my head every time I see a patient and I'm deciding what I'd like to do with that patient. I'm going to say, is this treatment safe for this particular patient? Yes, medical cannabis, we have developed a safe program for the patients in medical cannabis program. But is it safe for this patient with this medical background, with this surgical background, with these medications? Is it safe for that patient? Could it worsen an existing condition? I will tell you that if a patient has stage 4 level congestive heart failure, I would be very concerned about starting that patient on medical cannabis. I would want to watch them closely. I would maybe make them come back 1 month later after you've started to see if you're tolerating it. That's all what healthcare providers do when they start medications. Will it interact with other medications? If you're on blood thinners and I add medical cannabis, there's a problem there. Can this patient's heart, blood pressure, and overall health tolerate it? Because medical cannabis can cause a drop in blood pressure. Can that particular person with that health care background tolerate a drop in blood pressure? That's all things people need to do before they add medical cannabis. These are not optional considerations. This is minimal care of what should be delivered to every patient. There's medications I won't prescribe to certain patients because the risks are simply too high. Kidney failure, dangerous drug interactions, heart complications. Ignoring those risks would be absolutely negligent on my part as a healthcare provider. And I want to be clear about something important. When I'm caring for someone as a provider, I'm not thinking of them as a veteran. I'm not thinking of them as a teacher. I'm not thinking of them as a first responder. I am thinking of them solely as a patient, a human being that I'm going to add something to that could benefit but also could be detrimental. Their care is based on the health history, not their status. And under the current system, once that evaluation and shared decision-making that happens between me and the patient, the provider may certify the patient through the state's medical cannabis portal. And then you're right, we take over from that point on, and it is easy peasy. You go into the portal, you certify that patient, we make sure that whoever's certifying that patient is legal to certify them in our state, and then we get that card shipped on out to the patients. And then the patient is reevaluated annually under the same standards. In-person, evaluation, reviewing your health history, what's happened this last year, can I recertify you for another year? Or the provider who maybe is concerned may say, I want to see you back in 3 months to do an examination on you to see if this is being detrimental to you or not. It's called healthcare. So this bill removes these safety protections, but only for one class of patients, veterans. Now I will tell you, if I see a veteran and I'm going to evaluate them, I'm going to want to know even more about their health history. Because if you were a Gulf War veteran and you've been exposed to different chemicals in the Gulf War, I'm going to look at that differently. If you were an Agent Orange recipient, I need to look at you differently because there's healthcare problems that even the general population doesn't have, but our veterans do. Removing the physical exam and the inpatient evaluation from a healthcare provider who is knowledgeable in medical cannabis and just rubber stamping just because I found a condition that said PTSD in your chart that I can just say, oh, certifying condition, we're good to go there, is absolute negligent care in the state of South Dakota, and I would never practice that way as a provider, never. So even though this is really a noble intent about removing barriers, the worst part is removing guardrails of safety for patient care. And as a result, creates actually two standards of care. One, that patients who are not veterans have this high bar of standards of care, and the low bar is created for veterans. And so the veterans actually would have lower standards of health care than everybody else. So the intention is good, but the outcome truly can have a deadly effect on patients. And it's not a good way to practice in our state. I've worked really aggressively during my time in the Department of Health to reduce barriers of care, and I fully support continuing that work. But in good conscience, I can't support a well-intended approach that does so by removing the essential guardrails and safety protections for the people of South Dakota, including the veterans. You know, every patient really does deserve appropriate medical evaluation, safety guardrails when it comes to adding a type of medical treatment to their regimen. And I think our veterans deserve at least the same standard as everybody else gets in the state of South Dakota. So, you know, if you want to look at other ways to make access to care, there's other ways to do it in the medical cannabis program. Waiving fees for cards. You know, there's other ways that says the standard is still there for protecting, but we can make sure things are easier in those types of ways. So I would encourage you to look at other ways that you can improve the access to care for their patients into our medical cannabis program, because, you know, we are more than happy to help do that too, because we love our veterans as well. And at this time, I'm going to invite Cassie Deffenbaugh. She's the Division Director of the Office of Licensure and Accreditation, where the medical cannabis program sits, and she's going to talk some about the practical information that's related to this bill. Thank you, sir.
Okay, thank you. And I hate to cut you off before you even sit down, but we got a lot of bills here today, so if you could be as succinct as possible, I'd appreciate it. Thank you.
Yes, Mr. Chair, members of the committee, my name is Cassie Deffenbaugh. I am a division director in the Division of Licensure and Accreditation, and I oversee the Office of Medical Cannabis in my division. The secretary did a great job explaining the decision-making that would go into this process. What I wanted to touch on in addition to that is that these medical records have to be accepted up to 3 years old. There's a lot that can change in 3 years. Medicines can change, comorbidities can change, several other things can change in a 3-year period. In addition to that, it creates liability concerns. If a patient has a negative outcome as a result of cannabis, who is liable for that? Is it the Department of Health that then certified a patient based on medical records with them and never having doing a medical exam? In addition, I would just add that if you think of the number of veterans in South Dakota, we have an extreme number, which I'm very proud of. As a wife of a veteran and friend of many who have become family over years in the military community, I can appreciate the work that is being done here. But there are about 66,000 veterans in South Dakota. If you think about the number or the percentage of those veterans, depending on where those veterans have been in theater, their PTSD rates vary, but they are upwards of 30% in some of our veterans. Vietnam veterans, 30%. Our Operation Enduring Freedom, Operation Iraqi Freedom, 29%. The Gulf War, 12 to 15%. If you think of the number of veterans that could be in this, that the Department of Health would be required to certify, it would almost exceed the total number of patients in South Dakota that are on medical cannabis right now. That is a huge workload to the Department of Health. It will overburden our resources and require infrastructure changes, and it puts us in a position to take on certification of patients when we are a regulatory branch of the department. There is somewhat of a conflict there when you're talking about regulating the very program that you are certifying people to be part of. And the 18,000 patients we have in South Dakota right now, there are 219 practitioners that certify those patients. Over 15,000 could be on the Department of Health to review 3 years of medical records per person. And again, I want to recognize the good intention of this bill and the people behind it and the people that testified as proponents. We are very supportive of our veterans. I appreciate the work that this committee does. It is probably a thankless job, but a very important job, and it is impactful. So thank you for what you do. I do request that you vote no on House Bill 1255. Thank you.
Thank you. Are there any other opponents? Any other opponents? Seeing none, we'll offer rebuttal to the prime sponsor.
Thank you, Mr. Chair. Representative Tim Goodwin, District 30. Well, I think what we heard was about a bureaucratic reason not to do something that I've ever heard in my life. I mean, we have a cure out there, or at least it's something that'll make people well again, but we're going to hide behind all the regulations or how we have to take each individual patient and prescribe them individually. Of course you do. And we're not sitting here trying to tell them how to do their job. We're just saying we'd like our veterans to be able to get this cannabis. You can see that by the testimony that it's needed. So by doing nothing, we're just going to sit on our hands. You know, nationwide right now, there's 122 veterans that are killing themselves every day. So we're just going to sit on our hands and let that keep going when we have something here that could drastically help our veterans. And the other thing that I'm a little bit irritated about is states' rights. We're not beholden to the federal government. We have states' rights. And we can stick up for ourselves and say, federal government, we're going to do this. And everybody goes, oh, you can't do that because they're going to take your highway funds away or whatever. Well, Colorado legalized recreational marijuana 20 years ago. And they haven't lost a dime in highway funds. So I don't think we have to sit and worry about what if. Let's take action. Let's take care of the veterans we have right now. And if we pass this bill, we'll figure out how to get it implemented, and we'll figure out how to do it legally. We're not trying to do a thing illegally, and we can actually help our veterans that I think everybody agrees to this would actually help. So with that, I urge your favorable vote on this bill.
Thank you, Representative Goodwin. So we'll now close to testimony and open up to committee questions. Are there questions by the committee? Yes, Representative Jorgensen.
Thank you, Mr. Chair. Secretary of Health, please. Hi. Are any of these veterans denied access? Can they go to a local provider and get a medical marijuana card?
Mr. Chair, yeah, no one, veterans can access any of those healthcare providers. They are not forbidden from using the healthcare providers that specialize in medical cannabis use.
Follow-up?
Go ahead.
Thank you, Mr. Chair. Do you know what that costs?
It depends. It'll depend on that provider. The provider might do a $200, they might do a $1,000, but it's mostly around $200.
About $200.
Yeah.
Okay, thank you.
Other questions? Representative Baxter.
Question for the Prime. So I know a lot of veterans that love guns and then like to purchase guns. My question would be, you probably have filled out that ATF form, that 4473 as well. On there it asks about when they purchase a gun in regards to cannabis. So I'm just curious, will they lose their Second Amendment rights, and do they need to turn over their guns when they do this?
Mr. Chair.
Go ahead.
The next checks you're talking about when you go buy a weapon or a rifle, we'll say, for example, or a shotgun, it asks you if you've ever used ever used marijuana. The worst that's happened to anyone that I know of, if they did check that, is they just didn't get to purchase a rifle that day. There was no penalty to them or anything like that. I have been in contact with Senator Thune and Senator Round's office and Congressman Johnson, and they're working right now to get that form changed so that you don't, because we don't want to have it where people have to lie on a form.
Right. As I was looking at it, or follow-up, I did see that it's a felony for them to mark that, but I didn't look into how many people have been charged with a felony for it, but I was just curious about people's gun rights. Thank you.
Other committee questions? Yes, Representative Schubek.
Question for the Secretary.
Go ahead with your question.
Thank you, Mr. Chair. So I was looking online trying to find verified studies that weren't small sample on treatment of PTSD, effectiveness of treatment of PTSD with medical cannabis. Can you speak to that a little bit more? Because I couldn't find very much.
I think you're right, Representative, that, the research is small. But I think that's what the executive order of President Trump was supposed to do, is to open up for research so that those studies can be done in bigger context. I will say that the PTSD is one of the certifying conditions in the state of South Dakota.
Okay, Representative Andera.
Thank you, Mr. Chair. For the prime? For the prime? Sorry to make you get up all the time. Do you know that when this bill was drafted, was the Department of Health, were they brought into the discussion?
Mr. Chair, I did not have meetings with the Department of Health on it to get their permission to draft the bill. I did it so that we could take care of the veterans that really need help.
Okay, thank you.
I did ask the Department of Health in an email.
Ma'am, that question was not directed to you. That was directed to the bill sponsor. Are there other committee questions? Seeing none, we're going to close the committee question and open to committee discussion. Any committee discussion?
I have something. So, again, I really appreciate sacrifices of veterans. I am a veteran. My children are veterans. My husband's a veteran. My dad was a veteran. My grandfather was a veteran, World War II vet. I actually have a blood relative who is 100% disabled as well. So, love our veterans, absolutely. I think this bill is just a little premature. I appreciate the sponsor's heart in this. I think it's really great that President Trump has signed an executive order December 18th, 2025, where he's doing the research and they're looking at rescheduling marijuana to a Schedule 3. But right now it does remain a Schedule 1 controlled substance. And I appreciate good health care, and I appreciate understanding the individual holistic person and what goes on with them. And I don't think this is not a denial of access. The access is available for veterans. It's just that I don't think we should take a shortcut that might put their lives at risk. So that's where I stand on it. Thank you.
Thank you. And I'm going to, being as I'm the chair, I'm going to go back to committee questions because I had a question and I didn't ask it, so it's for the secretary. Sorry, that's what happens when you have to wait with your question. You forget to ask it. So just so I'm understanding this bill right, please correct me if I'm wrong. If this bill passes, what this bill is trying to do is just to have the veteran to be able to send their medical records to the Department of Health, and then the Department of Health be required to issue a card without an examination. And am I reading this thing right?
Mr. Chair, thank you. Good question. So yes, what this bill does would allow a veteran to send us 3 years of records, up to 3 years old, and we would scan through those records looking for somewhere written in there one of the 7 certifying conditions, and then we would certify them with no examination, with no review of the medical history, no review of interactions with medical medications, and then we would just give them a card without any of that evaluation.
And then the other part of that is, I think, what you testified to when you're talking about federal agencies not being able to recommend marijuana. That would have to do with the veterans' VA healthcare provider. Is that accurate?
Yes, Mr. Chair. That specifically is to the VA, the healthcare providers, and any federally funded healthcare entity.
Yep. Okay. Thank you, Madam Chair. We're back to the committee discussion. Yes, Representative Schubert.
Thank you, Mr. Chair. So here's what I know about PTSD. PTSD is a temporary, most of the time it's a temporary response to stress. And so when PTSD goes wrong is when people dump unneeded chemicals and alcohol on top of it. And substance abuse disorders come into play with that. And they extend the PTSD symptoms. Sometimes it's a forever problem, but in most cases, I know for a fact that it's temporary. So what I don't like about this bill is that it says shall issue based on conditions. So it's obligating the Department of Health to issue a card for something that could have been temporary. They may not still have PTSD, and we're going to give them automatic prescription to medical cannabis. So that gives me a little pause with this, so I'm going to vote no on this.
Thank you. Representative Andera.
Thank you, Mr. Chair. My concern with this bill is that you're bypassing the patient-doctor bona fide relationship. And the doctor's position or the certifying provider's position is to ensure that there is no contraindication, making sure that the patient can tolerate. This is all completely bypassed. I am not saying that this is not a problem. This is something absolutely we should address. We should do what we can do for our veterans, especially if this is something that they want. However, I think it is of paramount importance, and I am a new legislator and I am learning from the veterans here that are veteran legislators. Please discuss this with the departments, because the departments may have things that we didn't think of. Maybe they have solutions, but they need our help in bringing legislation. So I'm going to be a no vote on this as well. Thank you.
Other discussion and/or action? Yes, Representative Shorba.
Thank you, Mr. Chair. I turned 70 in July. That seemed to be a trigger for a whole bunch of things in my body that have been changing over the last 7 or 8 months. Looking back 3 years doesn't give me enough comfort to know that the current situation in that veteran is being considered in the assignment of giving them a card. So that's just a concern of mine. Thank you.
Yes, Representative Randolph.
I'm going to be the bad guy and make a motion 41st day.
Okay, Representative Randolph moved 41st day, seconded by Representative Andera. Comments on your motion?
Thank you, Mr. Chair. Well, actually, I don't really have that much to add because Representative Scherbeck, Representative Andera said pretty much everything that I wanted to say. The only thing I would describe this or add to this is that it leaves too wide of a gap between the patient care and the actual issuance of a card, simply just based on providing the records. And so,
other comments? Seeing none, the question before the committee is the movement of House Bill 1255 to the 41st day. Those in favor of that motion will vote aye. Those opposed vote nay. Madam Secretary, call the roll.
Excuse me. Representatives Andera.
Aye.
Elward is excused. Baxter. Aye. Jorgensen. Aye. Kaiser.
Aye.
Moore.
Aye.
Poyer excused. Randolph. Aye. Shorma.
Aye.
Schubeck. Aye. Weems.
Aye.
Reich.
Aye.
Goodwin.
No.
We have 10 yea, 1 nay, 2 excused.
That motion receiving the majority of the members elect hereby passes. House Bill 1255 goes to the 41st day.
Thank you, Mr. Chair and members of the committee. Representative Terry Jorgensen, District 29. And today I do have an amendment. It's Amendment 1280B, and it has been posted.
Would you like to move amendment?
Yes, I would like to.
Okay. Okay, we have a motion to move the amendment. Do we have a second? Second by Kaiser, Representative Kaiser. Okay, it's moved and seconded to move the amendment. All those in favor will signify by saying aye.
Aye.
Opposed, same sign. Amendment's moved. Okay,
All
now
right.
we're talking
All right.
the bill and the amendment. Go ahead.
Right, thank you so much. Basically, this act increases penalties for operations of drones over certain facilities, and it provides for mitigation techniques and countermeasures. We had to really pare it down because we're trying not to get out in front of the federal government, and there are going to be, or there already are, some required training. So I've got an expert in the room who's going to get into details about the bill. Thank you.
Good afternoon, Scott Rechtenbaugh with Department of Public Safety. I don't know if I'm an expert, but I'll try to answer some of the questions if you have any. But
Well, welcome. We're glad you're here.
Thank you. Mr. Chair, committee members, thank you for the opportunity. I'm here to ask for your support of HB 1080 as amended. I'd like to thank the prime sponsor for bringing the bill and also their willingness to engage with key stakeholders resulting in the amended bill before you today. DPS, Department of Military, DOT, and the Governor's Office have been actively engaged in this topic. Last fall, Governor Roden was one of 30 governors to publicly urge passage of the Safer Skies Act. In December, Congress passed legislation which would put in motion the ability to let state and local law enforcement play a greater role in protecting against unlawful drone activity. The Safer Sky Act permits mitigation only by law enforcement officers who have completed specific federal training. Federal agencies are currently developing the required training standards, operational guidance, and formal federal regulations. That process is underway but will take additional time to complete. Because of this, we worked with the sponsor on the amendment of HB 1280 to provide rulemaking authority to the Department of Public Safety under Section 5015.3. This authority would allow the department to establish rules identifying appropriate mitigation techniques and countermeasures to address unlawful drone activity over military and correctional facilities. Excuse me. Again, this authority would only be exercised after federal guidance is finalized and required training standards are clearly defined and available. Additionally, I'd like to emphasize that the rulemaking is a transparent and public process. We would follow rules outlined in SDCL 126, which requires public notice, opportunity for comment, and a public hearing. Any proposed rules must be reviewed by the Interim Rules Review Committee before they can be implemented. This ensures legislative oversight and public input throughout the process. These rules would be narrowly focused. They would address only the actions that trained law enforcement officers may take to mitigate unlawful drone activity in protected areas. They would not restrict lawful drone use, registration, or routine public operations. As part of these discussions, we recognize that there are other critical facilities that may also warrant similar protections. However, until federal guidance is finalized, it is appropriate to focus on the facilities already identified in statute. Once additional federal direction is available, we will continue to work with the sponsor and the legislature to determine whether expanding those protections is appropriate. Finally, this bill will also increase the penalty for a violation of the statute from a Class 1 misdemeanor to a Class 6 felony. The increased capabilities and easy access to drone pose a threat to the facilities outlined in this bill. An increased penalty is warranted to protect public safety, deterrence against malicious intent, and prevent testing the system. For these reasons, a stricter penalty is warranted. Thank you for your time and consideration. I respectfully ask for your support of HB 1280, and I will stand by for any questions. Thank you.
Yeah, thank you very much. We're looking for additional proponent testimony for House Bill 1280. Any additional proponent? Welcome.
Good afternoon, Mr. Chair, members of the committee. Savannah Cruz here on behalf of the Police Chiefs Association. We too rise in support of this bill and would just offer that from a local law enforcement perspective, this bill takes a meaningful step in the right direction in working to mitigate a real and growing threat to both national and local security. We respect the Department of Public Safety's ability to promulgate rules in this area and work cooperatively with them. As such, we would urge your support for House Bill 1280. Thank you.
Thank you very much. Okay. Further proponent?
Good afternoon, Chairman, committee members, Stacey Ackerman, Executive Director for the South Dakota Sheriff's Association. You have a lot of bills today, so I'll keep it brief. We support the bill and we appreciate the amendment that was been added to it. Thank you.
Are there any further proponent testifiers in the room? With not, let's take the one online. Tony Nashmare, are you on now? Tony, are you there?
I am. Thank you, Mr. Chair.
Go ahead, sir.
Can you hear me?
I can hear you loud and clear. Lima Charlie.
Great. Yeah, I appreciate it. I too am fully in support of this bill. I appreciate the Prime bringing it forward. I don't want to belabor the point, and I don't want to reiterate what everybody else said. I just want you to know that SEDETA, the Ellsworth Development Authority, is 100% behind this bill.
Can we ask you to say again where you're from? We didn't get your location.
Yes, Mr. Chair. I'm from the Ellsworth Development Authority. I'm representing SEDETA.
Well, that's why you're wearing a B-21 pin. Thanks for wearing that.
It is indeed.
Good job. Okay, thank you very much.
Even though I'm a B-1 aviator.
Yeah, cool. Conflict of interest, huh? Yeah. Well, thanks for your testimony. We really appreciate it.
Thank you, Mr. Chair.
Okay, that is all the testimony we have for a proponent. Do we have opponent testimony? Any opponent testimony for House Bill 1280? Any opponent testimony online? With that, we'll close testimony as, I guess, do you want a rebuttal? Okay, no rebuttals necessary. Thank you very much. With that, we'll go to committee questions and/or action. Is there any committee questions?
I move do pass.
Mr.
We have
Chair,
a
I have a
motion.
question. I have a question first.
You have a question first? Go ahead.
For one of the testifiers. Did we do that already, or did I miss it?
We asked for questions and we got a motion to do pass, so yeah, we kind of jumped ahead there.
Well, yeah, it was questions and/or motion.
And/or, right.
Yeah, so I'm asking for.
We'll back up and we'll let you ask your question. Go ahead.
Thank you. For the bill sponsor. Thank you. Good afternoon. For my clarification, for the rest of the group, a violation of this section is being adjusted to a Class 6 felony. That doesn't mean that the judge's his hands are tied to apply the entire penalty to anybody that's breaking the law. Is that correct?
Mr. Chair?
Yeah, go ahead.
Representative Terry Jorgensen, District 29. I am not a judge, but so I really can't answer that question. I don't know.
Okay, I can wait till, no. Well, now we'll go into comments.
Go ahead.
I had looked into this for another bill last year, and the judge has discretion. When somebody is arrested for a crime, then the judge has discretion as to what the violation is, unless it's a jury trial, and of course, in this case, it would not probably be that. So I'm okay with changing the severity up to a level 6 felony. So thank you.
Any other questions and/or committee action? Would you like to repeat your motion there?
I move do pass.
Go ahead. Motion do pass by Representative Schubeck, Shorma. Schubeck, I had it right. Okay, and then we have a second by. There she is down there. Representative Bandera. We have committee discussion. Yeah. Is there any comments on your motion? No comments on the motion? Representative Randall.
Yeah. To what Representative Shorma was saying, you're exactly right. It's generally, if you look at the penalties, it's generally up to, and I think Class 6 felony is up to 2 years in prison, and I think it's a $2,000 or $4,000 fine. Can't remember for sure which one, but I know it's up to 2 years in prison. But the judge has the discretion. You're right.
Any other discussion? Anything else we have to talk about before we do this? Can we call the question? Ms. Secretary, call the roll.
Representatives Andera.
Aye.
Elward is excused. Baxter?
Aye.
Jorgensen?
Aye.
Kaiser?
Aye.
Moore?
Aye.
Poirier excused. Randolph? Shorma?
Aye.
Schubeck? Weems? Reich? Goodwin?
Aye.
Mr. Chair, we have 11 yea, 2 excused.
Representative Jorgensen, would you want this on consent, or would you like to talk it on the floor?
Actually, I would like it on consent.
Okay. Anybody have a problem with consent? Okay, we'll put it on consent for next week. Okay, with that, unanimous consent, bill did pass. Congratulations. Now, this is going to break everybody's heart, so get ready to get your heart broken. We're going to take the Senate bills, which is the next ones, and we're going to do them at the next meeting next week. You guys, I thought you all wanted to stay. What's wrong with you guys? I talked to Senator Crabtree and the senators. They went and talked to everybody, and with time and as long a day as it's been, we got through the House bills, which was a paramount that we do because we have to have that for crossover. But we have plenty of time on the Senate bills. So unless anybody's really, really upset about that, we'll ask for a motion to close. We got a motion to close, seconded by Shorma. All those in favor say yay.
Aye.
Say opposed, same sign. We are officially adjourned.
From choir to debate to theater, SDPB shines a spotlight on South Dakota's talented students through SDHSAA All-State Fine Arts Programming. Good, useful, and full of wonder. SDPB. Every day, SDPB connects South Dakotans with stories that inform, inspire, and bring us together. SDPB, good, useful, and full of wonder.